Okay. Okay, good morning. I gather the room is open now, so thank you everyone for joining us. Welcome to the latest Duke University media briefing on the COVID-19 pandemic and its effects on society. I'm Greg Phillips with Duke Communications, and I'll be moderating this briefing. Today, we're discussing what the federal government, states, and cities must do in order to be able to reopen safely. Thanks to those reporters who already submitted questions. During this discussion, those of you joining us on Zoom can also ask questions via the Q&A window, and there'll be an opportunity to ask questions out loud in a few minutes. With me today is Dr. Mark McClellan. He is a physician and economist who directs the Duke-Margolis Center for Health Policy, where he works on strategies and policy reforms to improve healthcare. He was previously Commissioner of the US Food and Drug Administration and Administrator of the Centers for Medicare and Medicaid Services. Dr. McClellan, good morning.
Good morning, and thank you for setting this up and all of the reporters who are joining us today.
And thanks for being with us. So we'll go ahead and get started. You co-authored a 4-phase coronavirus response plan. Right now we're in phase 1, the containment phase, and reopening states is phase 2. But what elements have states got to have in place to begin phase 2 safely?
Well, we are moving from phase 1 to phase 2, and I think now people are seeing that phase 2 is actually not just one big step towards reopening. In some sense, that's probably the wrong term, because we're not opening back up to the way things were before. Instead, we're seeing maybe a phase 2A, B, C, D, and E with some steps forward and probably in some regions some steps back along the way as we gradually turn on the faucet. Enable some additional businesses to reopen under modified conditions, get in place some of the additional steps that are needed, as you said, for reopening to work successfully. And that includes several key dimensions. One is a healthcare system that is not under duress. So adequate capacity for potential further surges in the virus, and also adequate capacity at the same time to provide critical services that Americans need and many have been putting off, unfortunately, during this period of staying in place. Second key dimension is responses by businesses. We are all in this together with the virus still around us. So as businesses reopen, again, it's not going to be under the same circumstances as before. You'll see, hopefully, a lot of steps like we've seen in grocery stores and other essential businesses, distancing, additional cleaning and disinfection, practices among employees to make sure that if they are potentially sick, that they're not coming into work, that they're practicing the same kinds of isolation that we've had universally for people who do have symptoms or are at risk of transmission. And new steps by customers as well. Face masks are going to be common, respecting space, continuing to follow the long-standing advice about frequent hand washing or hand sanitizing and not touching your face, and being careful not to go out if you have any kind of COVID-19 symptoms, but instead follow the CDC guidance and get into testing. And especially we need to pay attention to protecting those who are at elevated risk of serious complications from COVID-19. So for older Americans, for those with comorbidities, this reopening needs to be especially careful on your part in terms of continuing to practice distancing and continuing to take steps to minimize your risk. And that means if you're living with people who are going out more, they need to take some extra precautions when they come back with you. I also want to emphasize the testing and containment part of this phase. So our test capacity is ramping up. It's not where we'd ideally like to be, but it is getting better. And I can talk some more about initiatives that are underway to improve that and our ability to trace contacts and contain any outbreaks that occur. So steps in multiple dimensions that should happen gradually with an expectation that we may need to take a pause in some areas and maybe even go back if there are signs of the epidemic picking back up again, because through all of this, the virus is still going to be with us.
Gotcha. Thank you very much for that. And that actually leads us nicely into one of the questions that we got from a reporter in advance from Sean Hamill at the Pittsburgh Post-Gazette, who asked about how important contact tracing is. And his question is, do we have the capacity to do enough and effective contact tracing to make a difference? And if not, how soon could we have that?
Well, I think it's scaling up at different places in different areas around the country, and the need for the volume of contact tracing that's needed is going to vary a bit as well. In areas that are facing continued increases in cases or a heavy burden of COVID-19 cases, even if they're on the way down, that's more contacts to trace. So those areas are going to need a more aggressive attention to testing and tracing as they start to reopen. In areas where there is more control, where there's a lower level of case activity, it's easier to get to the stage of being able to test and trace every case, which should definitely be the goal. And I think you'll see in the states that are reopening, hopefully some close attention to increasing that testing and tracing capacity. If you look around the country, New York and the New Jersey region, that northeast region, is expanding hundreds of contact tracers as part of their efforts to expand testing as well. In California, there is some innovative digitally supported efforts being set up, and in Texas, some of the academic medical centers like Dell Medical in Austin have increased capacity and bringing in many of these areas, people who have backgrounds in health as medical students, or who have other backgrounds, other repurposed public health or public employees, as well as people who are going through training programs to support the tracing capabilities. And you're going to see around the country in the coming days and weeks hundreds, thousands of new jobs as part of these efforts for containment.
And there's one follow-up there from Sean. Have we ever done contact tracing successfully in this country with a prior outbreak or a pandemic?
We do have significant contact tracing capacity in this country on an ongoing basis. So it's not just for when there's a new pandemic flu, like the H1N1 flu some years ago, or in the case of SARS, where we did have very effective identification of cases and then contact tracing and isolation and quarantine around them. Those are different. There also is tracing that goes on an ongoing basis for conditions like sexually transmitted diseases in this country. So those are different, though, in the sense that they haven't been as widespread, and there isn't as much asymptomatic or minimally symptomatic transmission. So here we have to be particularly vigilant when we see a symptomatic case to make sure that we're getting that case surrounded by rapid contact tracing. And to that in that way, this is effort that's going to be at an unprecedented level in the United States, just like testing is already at an unprecedented level for an outbreak for a pandemic in the United States. So I think you'll see a different scale, and that also means probably some new steps. I've talked about how digital technologies are helping augment the old-fashioned asking people about who they've been in close contact with, so that digital supports can help people identify that, and with privacy protections can be used to augment contact tracing. I've also talked about how this is going to be an effort that will span across other groups besides just public health authorities. They need help. So healthcare providers are going to be an important part of doing the testing and on potentially helping to identify contacts and helping people get the care that they need in isolation at home or somewhere out of the community, someplace locally, like a dedicated hotel or something like that. We want to keep those people as close to the community as possible, but isolated and out of our healthcare systems to minimize transmission and minimize the burden on the healthcare system. So role for healthcare providers as well. And I also mentioned at the top of my comments how businesses are going to need to participate in these efforts too, having programs in place to remind their employees about getting tested if they have symptoms and helping support these community efforts around containing further outbreaks.
Gotcha. Thank you very much for that. I'll remind everybody that if you'd like to ask questions, you can type them into the Q&A window, or you can raise your hand and we can get you to ask a question that way. I'm going to move on to some other questions we got in advance. This came from Michael Hyland at CBS 17, who said, we're expecting an announcement today regarding schools in North Carolina. Are there some unique considerations for reopening schools that are different from businesses and other aspects of society?
Yeah, I think there are two features that are distinct about schools. On the one hand, they are they are places where inherently there is close contact between children. That's impossible to avoid, especially at younger ages. So that means there's some potential risk for spread. And while the good news about the pandemic is that it does not seem to affect otherwise healthy kids very seriously at all compared to people who are older and those with chronic conditions. So the risk to the kids of contact and transmission individually is substantially lower than, say, for somebody who's 60 plus, but kids can still be potential sources of transmission. So the special considerations around reopening daycare, pre-K, as well as schools are going to involve trying to minimize that kind of transmission, partly for the kids' own sake, but also for preventing spread back to family members or others in the community. And so I think you will see some of these same steps, attention to frequent hand washing, disinfection, maybe not as much use in the pre-K of toys that can't be cleaned very easily, and maybe a bit more social distancing. I don't think we're going to see 2-year-olds with masks, but maybe more games where kids are flapping their arms or doing other things that aren't quite so close contact. So that's one key distinct feature, is that there is going to be more close contact in these settings, but steps to manage that. The other distinctive feature is that we really need to get our schools and our early childhood programs reopened. This is so important for the development of children, so important for their well-being, and also really important for helping their parents and the rest of the people in the United States to get back to work and be able to do more of their lives as well. So very high priority area, and you see a lot of effort to try to get this right. That doesn't mean schools and daycares are all going to be reopening right away, but it does mean, I think, some extra attention to because of these two unique features.
Gotcha. Thank you very much for that. Moving swiftly on, we have a question from Sarah Kruger at WREL. You've already mentioned the role of businesses here, and she asked, what do you want to see before all businesses can reopen like normal? Is it more testing, random testing, a vaccine, or something else?
Yeah, so I just want to emphasize that reopening businesses is not going to be the old normal. It is going to be a new normal. So I would like to see progress in those other areas that I mentioned. Healthcare systems are saying that they're good. They can handle not only the capacity for a potential surge in COVID-19, but the other critical care that they need to provide on a more routine basis for their patients who might have a breast lump or a complication of their heart disease or other issue that needs to be addressed in a timely way. So we need to support the healthcare systems. That's one area to try to check the boxes. We need to support increased testing and capacity for contact tracing, so that if there are outbreaks in communities, because virus is still present out there, that we're containing them. But for the businesses themselves, it's going to be a gradual process. So I think people have already seen what this can look like based on their experience with essential businesses like grocery stores. So this is not going back in and being in a crowded shop. It's going to be businesses where the amount of capacity is probably going to be limited way below, say, what the occupancy limits under normal circumstances would be, where there are going to be more protective barriers between customers and staff, where there'll be more distancing steps in place, maybe markers and other kinds of limits on where people can go, where there will be extra hand washing or hand sanitizing capabilities, especially to help with minimizing contact with transactions or things like that, and help people remember and carry out the frequent hand washing and or hand sanitizing that's needed to support reducing the risk of transmission, and facial covering, cloth face masks, and things like that as well. probably know people sitting around in waiting rooms, but I think you've seen with some businesses like pharmacies and waiting for a doctor's appointment, that'll probably happen in the car with a phone notification, a text message when it's about to be your turn. So not back to business as usual at all, but some significantly bigger opportunities for people to get the retail services and products that they need. And I think in other areas too, like going to the movies, watching a show, again, probably more distance and a different version of normal than what we had before. And I would expect this will unfold gradually. Some limited steps first are probably the best way to go as testing capacity keeps getting stronger and tracing capacity keeps getting stronger. Maybe we can, and we get more experience with this, maybe we can do more. But again, people should also not be surprised if there's a need for some pauses along the way and maybe some steps back along the way in certain areas as well.
Okay, thank you very much for that. One quick follow-up is that, do you think we'll ever go back to the old normal, or is the new normal just going to be the normal from here on out?
I think the old normal, when there really wasn't a worry about easy transmission of a virus that can cause significant health problems and death, that's probably a ways off. But it's also not going to be the way it is now, and with this kind of very limited opening, I think, for forever either. As you know, there's a tremendous, an unprecedented amount of work happening at unprecedented speed for developing vaccines that can help with immunity from COVID-19. And once we have widespread immunity again, and we need a lot of immunity for containing a very contagious virus like this one, but we'll get there. And I think we can pay attention to the steps along the way that'll let us know how the vaccines are progressing. Some are in clinical testing already, and there's some unprecedented steps, as I mentioned, to ramp up the capacity for manufacturing vaccines, even as the clinical studies are going on, to minimize the delay in going from a vaccine that seems to work in animal testing, that actually does work in human testing, to widespread distribution of that vaccine. Between now and I think there will also be some steps around improving therapy. So there are a lot of tests underway for drugs that can potentially reduce the severity of intensive cases that require ventilation now, where it seems like overly strong immune response may be contributing to the complications. If we could bring down the severity of those cases and make this virus less like the real threat that it is and more like a bad flu, that would help. Antiviral treatments that can also reduce the progression of the virus and the intensity of the cases. Those kinds of things will make it easier to move back in the direction of the old normal, even before we get vaccines.
Gotcha. We've got one other question we had in advance, and then I'm going to try and get through as many of these as we can before we have to go. A question from 𝐀𝐻𝐿 Ghosh at the Straits Times in Washington, D.C. She says, as we know, avoidance measures like social distancing are only as strong as their weakest spots. What would you identify as the weak spots in the US that health authorities should be particularly cognizant of? And are there any kind of unknown unknowns?
Well, I think in the context of gradual reopening, there's been a lot of thought to address what are the safest places and ways to reopen first. So in these initial rounds, probably not big sporting events, probably not bars, areas where there are a lot of people congregating together. I've talked about modified versions of going to a restaurant or going to a movie, maybe modified versions of even playing golf. So it's not so much that there are specific areas that are completely off limits as it is paying close attention to these basic principles of distancing even as we reopen, and the personal hygiene steps and the business cleaning and disinfection steps that are all going to be important. So with that, we also need to be monitoring closely for whether businesses and people are following these guidelines. To the extent that they don't, that's going to create a higher risk of transmitting the virus. And that will in turn lead to a higher risk of outbreaks. So we need to monitor how well the implementation of these steps are going and keep improving our ability to safely reopen as we go along. And I'd come back to the importance of people staying home if they do have symptoms that could be COVID-19, getting tested, and acting on those tests through contact tracing as well to keep the pandemic under control as we go through these reopening steps.
Gotcha. Thank you very much for that. I'm going to move into the questions that we have in the Q&A. And we have a question here regarding increasing testing capacity. Can you discuss the capital investments that labs will have to make into additional diagnostic platforms to enable testing numbers that we need? How quickly can we expect diagnostic manufacturers to be able to make and deliver new high throughput machines?
So the diagnostic testing capacity is going up. If you look at testing in the country today, we're probably doing well over 1 million tests per week, which is way beyond where it was before, but I think not as where we'd like it to be, given that there still are significant outbreaks around the country, and we don't yet have containment and the ability to test and trace every case like I was talking about before. So I do expect more capacity to come online. That's going to include more of these so-called point of care tests, like the Abbott lab test that's getting out into the community. FEMA has acquired a lot of those and is going to be using those to help augment community capacity where there are gaps. There are other point of care test manufacturers that are bringing their test programs to market too. So those are point of care tests that augment the so-called PCR lab tests, which are also a critical part of the testing capacity. I would emphasize, though, that besides just increasing the number of tests and test platforms available, we also have important further work to do in the logistics of matching the test capacity we have to the people who need testing in each community around the United States. And that consists of people with symptoms that could be COVID-19. It also consists of their close contacts if there has been exposure, and it consists of some important testing of people who don't have symptoms, especially in high-risk environments like nursing homes and other areas where people are close together, especially higher-risk individuals, and there could be transmission, where we really want to tamp down on those outbreaks quickly. And we are not fully there yet around the country, but the supply increases as well as new logistics support that every state and every region needs to undertake to make sure that they've got local access to capacity by healthcare providers, by people who need to get the tests in every region. So we've got a lot of tests, we're not using them optimally yet, and I think you're going to see some progress in that area too, logistics support over the next couple of weeks. For example, the Rockefeller Foundation just this week announced a major initiative to support many private organizations like Amazon Web Services and Palantir to help states and local governments with those logistics, and they're working them out right now.
Gotcha. Thank you. We have a hand raised. Steve Spraccia, you should be unmuted now if you've got a question for Dr. McClellan.
Doctor.
Steve, having trouble hearing you.
All right. If I talk a little bit louder, can you hear me now?
There you go. That's better.
Okay. Sorry about that. You mentioned vaccines. As a former FDA commissioner, what do you think about these calls about injecting disinfectants into the body or even using ultraviolet C to help beat this disease?
Yeah, I think that's definitely not a good idea. I think that people really need to understand that disinfection is very important for surfaces, for things that they may come in contact with. There are very effective disinfectants for killing the virus, and that is a critical part of reopening because we need to keep businesses clean or common surfaces clean. So you'll see hopefully deep cleaning and disinfection as part of this whole reopening effort. That is different. That's completely different from the treatments for people who have COVID-19. And ingesting disinfectants or anything like that is not it is still poisonous. It's not a good idea. For the treatments, it's important for people to listen to the public health authorities, the people at like Dr. Fauci, Dr. Birx, who are supporting these innovative programs and trying to accelerate them to make safe and effective treatments available. Disinfection is important, but not for ingestion or for preventing you or for improving your outcome if you have or at risk for COVID-19.
Thank you very much for that. We're going to try and get through another quick couple of questions here if we can. We have a question here. There are studies that are suggesting that a large proportion of COVID cases are asymptomatic, which would mean the disease is more widespread but maybe less lethal than we thought. If that bears out, how does that affect our containment strategies?
It means, as we've talked about there are a lot of asymptomatic cases of transmission. We don't know if it's 20%, 30%, 40%, but it is a lot, and it is a fundamental feature that we need to address in doing containment from here on out. That is why all of these distancing steps are so important. I was FDA commissioner during the SARS outbreak, and testing and tracing contacts was much easier then, because when people were symptomatic, or when people were able to spread the virus, they were very symptomatic. They were very sick. So that made identification of cases much easier, and it made containment much easier. Here, that's not at all necessarily the case. So it's very important for people, even with mild symptoms, fever over 104, sore throat, dry cough, to stay home, workers to stay home and to get tested to see if this is COVID-19 or not, and to be able to initiate the contact tracing. That's also why testing of people who don't have symptoms in high-risk settings is also important. I think we can get there with the test capacity that will be available in the next few weeks, and can get a long way there with the test capacity that's available now. As I said, there's still some hard work to do on the logistics of connecting those tests to the people who need them. And in the meantime, very important to take all these steps around distancing, around cleaning and disinfection at the businesses that are open, and very important for people who are at higher risk, those over 60 or 65, and those with underlying health problems, to keep in place some of these extra steps they're taking to avoid the risk of transmission.
Thanks so much for that, Dr. McClellan. We've hit 11:30. I think those are great points to end on. So thank you very much for your time. We do appreciate it. And thank you ever so much, everybody, for joining us. Our next briefing will take place next Wednesday, April 29th, when we'll be discussing the impact of the pandemic on small businesses. If you'd like to be included on the advisory for that event, please send an email to dukenews@duke.edu. And in the meantime, please stay well, and thank you very much for joining us.
Thank you all.